I want to share my story about my complications with pelvic outlet dysfunction and how it completely changed my quality of life. I was having difficulty having a bowel movement and was being treated by a gastroenterologist that had run several studies and tests to determine my illness. After several tests and no answer, I had to resign at my job because of the multiple bathroom breaks I had to take. It was like I had sharp knives inside my lower abdomen region, with the sensation of needing to have a bowel movement, but nothing would happen when sitting on the toilet. After some time, I was seeing a gynecologist for my other issues, such as painful bladder with urination, which I could have sworn were urinary tract infections, but the results and cultures would return normal with no bacteria. I then was referred to see a colorectal doctor for my ulcerative colitis that had developed overnight. I was taken to the ER for fainting spells because the pains were so debilitating. After several consultations with colorectal, gastroenterology, and gynecology visits, I was told I needed to resort to a colostomy bag. I then researched further and found a pelvic therapist that worked on GI issues. After just 3 sessions of internal manual therapy for decreasing muscle tension at my rectal region, I started to regain control of my life again. I was able to have normalized bowel movements and no pain or inflammation in my sigmoid colon. I was able to learn about muscle conditions and other disorders that were similar to my symptoms. It was then that I realized I wanted to extend my story to others in similar situations. I went to school and obtained my physical therapy assistant license so I can enter the world of women and men's health and pelvic floor therapy. I'm now able to guide my patients and help them to try to gain back their life. I wish there was more education about these types of conditions. Thank you all for listening.